I think you have an interesting kind of journey story relative to healthcare, and let's just spend a few minutes talking about that with the group.
Yeah, I actually grew up being very scared of medicine and biology as a field and kind of was a tech nerd, like stats, physics, computer science, got into it. I grew up in India, got into it very, very early. Was primarily working in robotics and AI much before it was exciting as a field broadly. And actually, it was during my time at Stanford that clinician colleague who's a neonatologist, this is around 2007, pre-High-Tech Act, Stanford was just starting to implement the electronic health record. In fact, Cerner at the Children's Hospital. And literally the question was, could we be looking at all this data from the EHR and all the monitor data to be able to monitor babies at risk for complications and bring a machine learning AI point of view to it where we could identify babies at risk for complications early. That was the first time ever I had encountered a problem in medicine. And then before I knew, I was sitting at the basement of Stanford during Christmas, reading this big, thick book on neonatology and trying to learn CCL, which is a language to pull data out of Cerner. And I didn't know what I was getting myself into. Since then, it's just been a downhill journey. But let's just say I love it. It's been the most exciting set of problems I've ever worked with. And it's very easy to work 20 hours a day and not feel like you're working very hard.